Hey everyone, Dr. Matt Geller here. I'm here with Dr. Kennedy, recent graduate of SCCO. You're licensed in California and in Texas, and you're doing an internship now. Tell me a little bit about that.
Yeah, so I'm out in Dallas doing an internship with a large lens manufacturer who also is really looking in the optometric field as well. But it's a really great experience to kind of see, a different side of optometry. We're used to seeing our patients in clinic, doing everything like that. So it's nice to kind of see the flip side and what goes behind all those processes.
What made you want to kind of, feel out this other angle before you started seeing patients?
It was an amazing opportunity that presented itself, first of all. And then after that, I'm really passionate about and interested in kind of, physician advocacy in these different areas outside of the lane as well. So that's kind of what drove me to do it, and then we'll see, I'll probably go back into patient care, and then having that experience and pulling that in will just allow me to better provide for my patients overall.
What are some of the things you get to do or skills you're learning?
I think the most important thing actually is the soft skills that you build. In school, again, you're so regimented and studying and really being on a schedule, but you really learn kind of those communication skills. You learn how to really present yourself and communicate better with your patients.
Do you see a future for yourself there? Do you think that other ODs should look into having at least, whether it's consulting or part-time or full-time opportunities, working with medical device companies, contact lens companies, whatever it might be? For
me personally, again, it's kind of a passion of mine. I would love to kind of shift that way. I think for ODs or new grads in general, and with the changing landscape of optometry itself and medicine, it's really important to kind of have that really well-rounded view of what's going on. And I think these conventions that we have are great opportunities to meet those individuals, especially who are doing a ton of different things. And so it's really inspiring when I come here and I get to talk to all those individuals. And I'm like, oh man, well, maybe I should be doing something else too. And I kind of perk up and listen and say, oh wow, that's really interesting. Can you please tell me more about it? You have to look at all of your options to have an accurate idea of where you're trying to go with your career, which is going to be a long one. Optometrists, you practice, you get out at 27, and there was just an article on optometrists who retired when he was 100 years old.
Saw that.
So, you could move into so many different avenues, and if you don't kind of introduce yourself into these different areas, you might just stay in the lane the whole time when you could, like you said, you could be consulting, you could be developing your own brand and doing different things. It'll be interesting to see what happens with the new grads coming out and kind of those changing mentalities that you see. Absolutely. Maybe some of the problems optometry or eye care has encountered before is because of the lack of innovation on the OD's part. We wait for outsiders who see a market opportunity or the ability to generate revenue who have no clue about eye care. And then you look at companies where ODs were involved from the get-go, and I think you have a more positive outcome. So I'm all for it. Thanks. Thank you.